Hello, I'm Hayden Pailthorpe and I'm a third year student at Cqu University studying for my Bachelor of Exercise and Sports Sciences degree. And today we'll be talking about the literature review that I've done on the area of the use of exercise to improve gait in people with Parkinson's disease. My student number is S02285556. Contents page is a brief overview of the presentation. Background, methods, finding, discussion, and conclusion. Essentially, the definition of Parkinson's disease is Parkinson's belongs to a group of conditions called motor system disorders. These conditions, which are the result of loss of dopamine producing brain cells, and it is a neurological disorder. There are two different classifications of Parkinson's disease, one being hypokinetic, which is rigidity and postural instability, and that can occur from a sedentary lifestyle and lack of exercise. Hyperkinetic is tremoring, and that can come because of psychiatric syndromes and depression, such as anxiety, but also just lapses in your neurological functioning. Background of Parkinson's disease is it's a progressive disease which continues and gets worse and worse as you age and you continue on. Neurological disorder, which I said previously, and the objective of this whole literature review is just to check and see whether exercise actually improves Parkinson's disease at all. People with Parkinson's are just described as 29% less active than peers, Van Nimwegen, 2011, and approximately 4 million people have been diagnosed with this disease. There are four main primary symptoms of Parkinson's disease: tremor, trembling in your arms, legs, jaw, face, rigidity, stiffness of your limbs, bradykinesia, or slowness in movement. Van Nimwegen, 2011, sorry. Impaired balance and coordination, and the pooling revealed that cognitive motion intervention can improve gait, speed, impact. Objectives of the literatures that have been reviewed were increase in muscle strength, increase in stability, and increase in everyday efficiency. The background: exercise improves symptoms of Parkinson's disease, affected areas of gait and posture, neurological progression, disease, cognitive motor intervention improves gait, and treadmill training improves gait. Most of the reviews the articles that I've reviewed have been mostly focusing on treadmill training to improve functioning. Okay, the methods that I used was a comprehensive review of the literature performed using the engines PubMed, ScienceDirect, Sports Discus, Google Scholar, and the resources were within 10 years old. And the search terms that I used when doing this review were Parkinson's disease, exercise, limited to gait and peer-reviewed, and cognitive motor function, along with the species, which is a human, which can be misinterpreted sometimes on these sites in the advanced engine. Okay, so the findings were that Nikkei and Tashima, 2014, did a home-directed exercise therapy at home, and the small sample size showed no significances in gait. Wang had two control groups of RCT, which is randomized control trial, and abstracted data with 181, which was quite large, and there were significances in gait. Ford was using a dual task gait training intervention, and the small sample size showed slight improvements in speed of gait. Fernandez used dual task training, and the sample size was slightly larger, however still quite small, and there was a slight reduction in gait variability. Bello used a variable comparison, and it was a pilot study, and there was a slightly larger, again, sample size, but still quite small, and there was a slight improvement in all gait parameters. AN used two interventions, one group using land and the other using water. Still quite a small sample size, however there were no significant differences in gait. However, postural stability was increased. Giroux 2012 used music-based movements, and that was an auditory intervention, and there was quite a large sample size with 168 with significances in all gait parameters. Skidmore used a TRT, GBE, and TAT, which are treadmill exercise testing, which is TRT, gait and balance evaluations, GBE, and treadmill aerobic exercise training with TAET. Small sample size, frequent trials, and there were significant differences in speed and cadence. Van Nimwegen was quite a large sample size, and there were slight significances in difference in gait. However, the limitations were you had to be under 80 years of age, which is quite good for the studies. And then Smith used a multi-directional training on the treadmill and post-intervention assessments. Very small sample size, and there were slight significances in all gait parameters. Findings: we have increase in motor function, increase in fitness, increase in stability, and increase in cognitive functioning. Exercise procedures, such as parkrun, treadmill training, any sort of walking is going to increase and improve Parkinson's disease symptoms, just as the progression can be halted or paused, but it's never really going to fully cure the disease. The only thing that will improve the disease is just constant exercise, as shown throughout this literature review. So physiotherapy classes are good. Static movement and muscle stimulation can also be beneficial to those patients. Gait after exercise, speed of movement, length of stride, postural stability and cognitive functioning all increased AN 2012. In conclusion, exercise patients with Parkinson's disease is not optional but mandatory in order to counteract the progressiveness of the disease, and research presented in the review shows that the implementation of exercise can not only delay progression but improve gait and some steadiness. Walking on the treadmill may be used as an easy, effective, and accessible way to improve the stride length and balance of Parkinson's disease patients. Combination of exercise types would be beneficial, and future studies may want to incorporate multiple exercise interventions. Larger sample sizes are required to prove significant in journal